We typically talk about health insurance options in the fall during open enrollment. But like many things, it is different this year. And President Biden has instituted a special enrollment period and extended it until August 15th for those who need to change their health care coverage. MJ Johnson is an insurance broker with HealthCare Solutions team in Venice, and she joins us with some very helpful information about the changes that could be coming. Welcome back and congratulations. I understand you have been nominated for Best Business for 2021 for the Venice Chamber.
Yes, I'm very honored. I'm humbled. I was so excited I couldn't believe it.
Well, you provide such an important service by helping us find affordable health care coverage. So explain what's going on right now in terms of being able to change insurance plans. Are there any stipulations?
There are some stipulations when it comes to Medicare, for instance. A lot of people are under the impression that they can just turn around and change versus waiting for it to start again October 15th. The whole premise behind President Biden's initiative is that we would go ahead and help those who possibly just lost their job, who maybe have lost their job a month or two ago, and it's like, where can I cut the budget so I can pay the rent? Those are the type of people that we're helping.
Okay, great. Now, overall, since there has been some job loss and insurance concerns as a result, in your opinion, how do you feel that the pandemic has impacted the health of our society?
Oh, it's had a huge impact. Many people do not know that health insurance can be provided for you, such as a financial advisor does a portfolio for you. You don't put all your eggs in one basket. Okay, so they'll put a little bit in a 401k, maybe a little bit in stock, so on and so forth. I look at health insurance the exact same way. So I do hospitalization separately. I do physicians, doctor visits yearly, pap, mammo for the women, all separately. Telemedicine is part of that plan. So when you do it that way, you cut down many of the costs, and such as the plan I was just discussing, for a single person is $120 a month. This way, you're going to stay well. You don't want to get sick. But statistics have shown that people, they don't know that this exists, because most insurances, if you put all your eggs in one basket, you need to meet the deductible before any of the benefits really kick in.
Okay.
And even
just so I understand what you're saying, so you're saying that even when you put together a low-cost plan, you're still able to have those different components, so we're not missing anything per se?
Yes, ma'am. Definitely. I do a long interview with a client when they call me for a system. So I want to know their background, their health history. And finally, I'll say to them, what have you budgeted for health care? And you'd be amazed at how many people haven't budgeted anything. And they say, well, I don't know. I said, well, compare this to buying a car. You want to get something good, but you want to get something that's going to meet your budget and that you are not going to have taken away from you because you didn't meet the monthly premium. The way I do it, they could add on hospitalization, critical illness coverage, dental vision, anytime they want. We're the private sector. I am not doing the Affordable Care Act, and President Biden's initiative deals mostly with the Affordable Care Act.
Okay, so I think the great thing about this is it's so intimidating to try to do this by ourselves. So I love the fact that you sit down and kind of give us some guidance through what's a very, complicated procedure. Do me a favor, remind us again about your background and how it led to you wanting to help people with this coverage.
I'm a seasoned master's prepared nurse, and I got to the point where I love to help people, and I've always been that way. So if you got a problem, I'm there to solve it. Even though my old CEO told me all problems cannot be solved. But I got tired of politics and a lot of other things when I was in administration. So I said, how else can I do it? And what am I disgusted with? So I was disgusted with the quality that these clients were paying for insurance. They weren't getting anything covered that they needed. It was what the company wanted to offer them. And I guess because the price was right, they went for it. So I'm just shifting all my knowledge to another venue. And that's why I started the business.
All right, and it's certainly helping a lot of people, so we certainly appreciate you for that. To get more information about any of your healthcare solutions, you can go to mjjohnsonconciergecoverage.com. We'll be right back.